focus on strategic planning. We'll give everybody just a few more minutes for those who will be arriving a little late. Thank you. Okay. Hi, everyone. Thank you for joining on our first learning community focused on strategic planning. My name is Laura Fabius, and I'm a policy analyst here. We ask that you guys keep yourself muted and only unmute yourself during the roll calls. If you look to your bottom right-hand screen, you'll see a little chat box. If you have any questions for any of our presenters or for me, please type it in. We'll get it at the end of the presentation. We will be fielding those questions. Once again, thank you for joining in. My name is Laura Fabius, and I am a policy analyst here at CSG on the law enforcement team. Today's presenters are David Demore. He is a senior advisor here at CSG, and Jessica Murphy. She is part of the co-responder team leader at the Johnson County, Kansas Mental Health Center. Today, we will be having an overview on the importance of strategic planning, go over some of the basics, towards data-driven decisions and funding and sustainability. We will also have a presentation by the Johnson County Mental Health Co-Responder Program. And like I said, we will be fielding questions at the end of the presentation. Session of objectives. Today, you will understand the importance of articulating why your organization exists and where it is going, determining how your organization will fulfill its mission and achieve the envisioned goals, determining the next steps to be undertaken, become aware of planning tools and resources that currently exist, and appreciate the link between stakeholder engagement, data collection and analysis, and program effectiveness and funding and sustainability. Here's a little poll. We asked that our grantees, if you just type it in, please select which of the following strategic planning components and activities are part of your grant. that you have already been done in your jurisdiction. Please select all that apply. I'll give everyone just a few moments. Great. Great. So now we'll be doing a roll call, and I will ask the department to please unmute yourself when I call on your department. Everyone else, please be muted. I'm also going to ask that you tell us a little bit about what you selected during the poll, what actually you plan on doing with your grant. So first, we'll start off with the Phoenix Police Department. Is anyone here from Phoenix?
Hi, Nick Margiotto's on with that. Nick Margiotto's on with Impact. He's their partner.
Hi, Mark. So please tell me, so what did you select in the poll? Nick, can you hear us?
Yep, I can hear you now.
Okay, great. So what did you select? What do you plan on doing? Or what has begun already?
Well, the poll wasn't working, so we wasn't able to do that. But we've basically done most of our planning. Our budget's not been approved, so we obviously haven't started implementation. But most our planning is all pretty much ready to go.
Great, great. Well, thank you for joining us, Nick. Thank you.
As far as I know.
The Division of Criminal Justice in Colorado.
So can you hear me?
Yes, we can hear.
Okay. Yeah,
I'm not
we're.
sure I know what you're saying, but at the bottom of my screen, I see a little microphone that tells me I'm muted.
Hi. If you're not speaking, can you please mute yourself?
So our project involves the sequential intercept 0 and 1. And what we're trying to do is look at the dispatch, 911 dispatch, and we've done a lean process mapping of that and looking for ways that we can do collaborative responses with our new crisis services so that we can send out behavioral health resources when crisis calls involve substance abuse or mental health crisis. So on the poll, I think we're doing a bit of all the selections that you offered.
That's good. Thank you. Thank you for that. Warren County, Kentucky.
Absolutely. Hey, this is Curtis Hargan. I'm a captain with the Warren County Sheriff's Office.
Hi. So tell me a little bit about your program and what you plan on doing.
I think right now we're still in the strategic planning phase, but in reference to just mental health and how we can better and more efficiently utilize our resources in partnership with other businesses here in Warren County that offer screening and other related concerns to mental health.
Great. Thank you. Boston Police Department. Hi, anyone from Boston on? Well, Boston. City of Muskegon.
This is Heather Wiegand.
We do have somebody from Muskegon on. I think she's on mute. I see her. City of Muskegon. City of St. Louis Police Department. Clemson University in South Carolina.
Good afternoon. This is Lieutenant Chris Harrington with Clemson University Police. So, what our intention is with this grant opportunity is to engage in a collaborative effort with a lot of our community stakeholders, and in particular, some of our regional mental health service providers and the university's specific counseling and psychological service entities in order to evaluate our own response protocols, that of the rural agencies that surround the university proper, and begin to look at best practice models on training implementation, programming, and ongoing resource provision. So in regards to the poll that you had earlier, we do have an interagency planning team, and we also have collaborative stakeholders from outside of the agency that are taking part in that. And we have begun a pretty good amount of policy and procedure review and revision. Some of that's in conjunction with some accreditation process that we're going through. But some of it also in anticipation for where we'll be going with this particular grant opportunity.
Great, thank you. City of Lubbock. City of Lubbock, can you hear us?
Hello, can you hear me?
Yes, we could hear you.
Oh, perfect. This is Heather Wiegand. And I know that on the line we also have.
Okay. Would you maybe just give us a little snippet of your program and what you plan on doing, City of Lubbock?
Our community plans on building a crisis intervention using the international CA model. And the City of Muskegon Police Department was kind enough to have leadership of this project. But we do have 10 municipalities in Muskegon County that will be participating.
Sorry, just a little difficult to hear you. Can you just repeat that? I'm sorry.
Yep, we here in Muskegon will be building a crisis intervention team using the CIT international model. And we have 10 municipalities that will be participating.
Okay, great. Thank you so much for that.
Hello?
Yeah, so,
Hello?
yes, hi.
Okay,
Hi.
now you can hear me. This is Will Pinckney from St. Louis.
Oh, hi. How you doing, Will?
Good. Sorry, I don't know what it was. I was talking. You couldn't hear. Maybe it was the way I had dialed in. So, yeah, I'm sorry. Can you repeat now? I lost track of what we were supposed to say.
No, just a little snippet of the poll earlier. Like, what do you plan on doing with these funds, with the grant funds?
Okay, so we are planning on doing the planning portion and doing some protocol reviews. We are working with some partners now. We had started working with partners around crisis services, mental health behavioral services, and so these funds will allow us to, form a group and to be able to work through a planning process and how the department engages with that population.
Great. Thank you. Thank you so much for that. Did I miss anyone? if you're still having trouble logging in, we can see in the chat box, we can see your comments. So at the end, we'll give everybody a chance if we didn't introduce you to introduce yourself. And please type in any questions that you have with building questions. So now I have the pleasure of introducing David Demore. He's a senior advisor here at the CSG Justice Center. So we will start off with David. Thank you so much. David, it's all on you.
Good afternoon, folks. Thanks for joining us, and I appreciate the fact that you're spending some time with us. I'm just going to take a second here and check and see if the ball has been moved. It has. I'm going to take the next 25 minutes or so and talk about strategic planning. I want to make a couple of points right up front there. First of all, I was taking a look at the different departments that are here, and I know of many of for many of your folks, I know of the work that you've done over the years, and want to be really clear that we realize that many of you have worked on various types of strategic planning quite successfully over the years. At the same time, when we look at this grant track, we need to make sure that we at least have a common way of talking about things, and that we're able to, with all of our grantees and all of our TA coaches, be sure that when we're talking about what it is that needs to happen, when we're working with people in terms of moving their project forward, that we have a common language. So we're going to talk about some of that today, but I really want to be clear that we very much respect the work that many of you have already done and the knowledge that you have, and that this is more to make sure we have a common language and are on the same page as much as anything else. Looking at that, it starts right with the basic thing of, well, why even bother to plan? And one of my favorites from Lewis Carroll is, well, which way should I go? And the Cheshire Cat says, well, that depends on where you're going. And Alice says, I don't know where I'm going. And the Cheshire Cat says, well, then it really doesn't matter which way you go. And unfortunately, too often in too many organizations, whether they are private or public, whether they are governmental or non-governmental, we operate in exactly that fashion. And then sometimes we develop a plan, but we don't necessarily do it in the best way that we can do that. In the beginning was the plan, and then came the assumptions, and the assumptions were without form, and the plan was without substance, and darkness was upon the face of the workers. I don't know about all of you, but having been in the field for a good number of years now and seeing many changes over the years, one of the things that I always worry about when I am facing a large group of folks are those blank faces who feel that, oh my goodness, here's another plan, and here's another thing we're supposed to do. Is the 25th in the time that I've been doing this work, and it is not clear to me, and I don't know how it is that we're going to get to the next step. And so I'm just going to keep my head down, and we won't see very much change happening. That has to do with our communication. It has to do with how we develop our plan. It has to do with who we involve in our plan. And so when we talk about strategic planning, we're talking about a method to devise and to employ plans or strategies toward a particular goal, which is why Laura was asking, what are the different goals that the different departments here have in terms of this particular grant. And they allow for timely and informed decisions that happen through hopefully data-driven kinds of approaches, that they are decisions that we can back up with good hard numbers that clearly support why it is we're moving in a particular direction or away from a particular direction. It offers clear direction about what the organization will and also will not do. One big failure of many strategic plans is that it talks about what an organization will do, but forgets to talk about what it won't do. When done well, strategic planning can increase the empowerment of the staff. It can help make sure that there are clear boundaries through increased communication. When done poorly, strategic planning is done by a very small group. It doesn't involve people from different levels, and you have those dark and blank faces that we were just describing a moment ago on an earlier slide. To be clear, strategic planning is not forecasting, telling the future. It's not simply applying the quantitative data or measurement to organizational planning, and it does not eliminate risk. It helps quantify risk. It helps understand what the degree of risk is in relation to the decisions being made. It is concerned with looking at those decisions that are being made today that will affect the future of the organization, but it's not a forecast. It cannot tell us where we will be in 3 or 5 years. It can tell us where we want to get to in 3 or 5 years. one of the reasons that I say that is that when I talk to a lot of organizations that are against the idea of strategic planning, and it may surprise this group, but there are many organizations that do not look very favorably upon it, and certainly don't look favorably upon the idea of it going beyond a very small group, is because they're concerned that when they develop the plan, that when they look at 3 or 5 years down the road, that people will have seen it as a forecast, and when they don't get exactly to that point, that they will be seen as having failed. And very clearly, that is not the case. There is no such thing as a strategic plan that we can always hit 100% of the time, but it is the roadmap to get as close to that end goal as possible. To look at a simple model of strategic planning, we would be looking at a step-by-step approach that answers 3 questions. First one is, well, what are you marketing? And we indeed are marketing, even in our public work. Who are our target constituents? And how do we beat or avoid the competition? And in our case, competition often means other government agencies or other private agencies. It's competition for funding, sometimes competition for recognition, competition for political support. So it's a little different than competition between folks that are putting out products per se, but nevertheless, that issue of competition very much exists in the work that we do. Simple doesn't mean simplistic, just to be clear. We all know that there are major and complex issues that are involved in the work that we do. It really does require gathering and digesting and analyzing a great deal of information. And it's also important that we sort of start big at a very high level and then begin to sift through all of the noise as we move forward. Strategic planning really does need to start at a higher level and move forward. When we make strategic planning about too small of an item or an area, we end up often missing the forest for the trees. And so it is very important that we start big and then move down and get more granular as we move forward. Starts with really looking at the issue of completing an organizational assessment, which can be a really powerful tool to identify one's organization's strengths, as well as their challenges, their weaknesses. It helps us understand where the organization is currently and also what it needs to be able to grow. And that might be assets, as in people, or resources, as in dollars. It might have to do with the physical plant. It might have to do with the deployment of staff. It might have to do with the overall organizational structure needing to be different. And it might have to do with training and how training occurs, when it occurs, how it's measured, et cetera, or any combination thereof. It really is critical to complete those things and to understand them before attempting to institute change. It is quite typical, you all know that old saying, I assume, that culture eats planning for breakfast, if you will. And the reality of it is that if we don't understand where the organization is right now, then ultimately where we want to move it to will typically create a great deal of resistance among the folks that we're working with. The organizational assessment involves a critical review, which means an honest critique of the organization, not simply a series of complaints. And again, an honest critique, not simply everybody being upset and complaining about this item or that item, but really looking at both the positive and negative and the gaps that exist in the organization. It can be done in different ways. It can be done as a whole in smaller departments, or it can be done by units, or it can be done by divisions, or it can be done by specialty areas, or it can be done by shifts. It can be done by computer. It can be done on paper. It can be done in person. There is no one right way, and depending on, among other things, size and distance, different choices have to be made about how to do that. What is important, though, is that in whatever decision is made about the process, that the process is done in a way that you can assure that you get the information and the feedback that you get. In other words, you can't have a lot of folks in the organization opt out, or else you do not end up with the real picture of the organization that you need. When you complete an organizational assessment, there are different areas that can be looked at and can be included. They don't have to be limited to these by any means, but sort of looking at these, if you're looking at a very simple or straightforward assessment, you'd be looking at things like a review of dispatch and record data to compare yearly trends. You would look for significant increases or reductions, and you would attempt to determine why any of that has occurred. So you could keep it fairly high level, fairly simple and straightforward, or you could go way more comprehensively, looking at reviewing all of the training, looking at the various crime areas, looking at deployment of officers and other staff, looking at investigation units, looking at patrol, looking at the administrative operations, looking at the specialty units. So again, depending on your internal resources, on the size of your organization, on the time that you have and other capacities, you can go high level and relatively simple, or you can get very comprehensive and really get very granular in terms of what it is that you're looking at. You start this by studying the way that it is right now, basic information and data. No judgments are made here, just gathering as much data as possible. You then build some assumptions that are based on that information, again, without judgment. And that becomes so important. One of the big problems that we often see when folks are doing this is that they very quickly make decisions about what the problems are on relatively basic data that they have not really then tested that out fully. They have not pulled enough people in to really examine it. And so those assumptions have to be made without judgment. And one of those judgments that you see is that often very early on, people decide they already know what the solution should be. And when you hear that at the opening stages of any kind of assessment, you can almost be promised that it will be wrong, because it is, people are just moving too quickly in terms of getting to that end result. They're basically looking for information to support their bias rather than being quite open and trying to gather all of that to reach a particular judgment at the end. This becomes the foundation of all further strategy discussions and decisions. So it really does need to be reviewed very carefully. It needs to be shared appropriately. It needs to be examined by not just one group of individuals or one level in the organization, but by various levels in the organization. A way to think about it is to sort of look at this chart, and what you have here are sort of these two boxes feeding into all of this. On the left, you have the data gathering piece and component, looking at external situations, things external, in other words, to the organization, looking at internal, what's happening inside the organization, looking at the capabilities and the competencies of the organization and of the folks in the organization. On the right, you see the ideas that folks have, in other words, the assumptions that people have. You're wanting to pull those things together. You're wanting to analyze the information. That's where you develop your analysis in terms of a strategic assessment, looking at the strategic issues that you need to figure out. After the analysis is when you think about the issue of the direction that you're going to go, and you develop those strategies. And so, again, what I was saying just a little bit earlier is that what happens is that too often people collect a little of the data, your left-hand box, develop some big ideas, your right-hand box, and go directly down to, here's the direction we're going to go, without careful analysis and determination of, first of all, what does all of that mean? And second of all, what is realistic for us in terms of moving forward? What can we do? Because depending on where you are, the size that you are, the nature of the organization, where it sits in a county or a state, where you can go is dramatically different, even if the issues you describe in each of the organizations are similar. After that issue of the direction and choosing the strategies there's the obvious issue then of how do we commit to this, the things that we all know about. I suspect every one of your departments, your organizations has a mission statement. You have a set of goals and objectives. One of the things that would be important to look at would be whether or not your mission statement is current, whether it still reflects what it is that you think in your new direction should be, and whether or not your goals and objectives that have been previously set need to be modified. And by definition, it almost definitely will be the case that as you are all looking at this, you will need to be making some modifications in one or more of those three areas. And then finally, there's the issue of implementation. That's where you do the development of action plans, budgets, schedules, again, all of those things that we know need to be done. But the steps between gathering the data, having the ideas, and implementing are exceptionally important, and too often, quite frankly, in our experience, too often skipped over. And we go from step 1 to step 5 way too quickly, without really analyzing, among other things, the risks and the potential that we would have if we move forward with the plan. This is another way to look at it in terms of thinking about it just in a different visual, if you will. You can see some of the very similar kinds of things here. On the left-hand side, there's the planning piece, what you're all involved with. The gathering information, the assessing the capabilities, the making of assumptions, the making of strategic assessments, formulating the strategy, establishing the goals and objectives, and then formulating a tentative implementation plan, and then finalizing that implementation plan. One of the things that I have learned over the last decade working in the organization here at CSG is that as we've worked with multiple states, both in terms of legislation and in terms of technical assistance around plans that they develop, is that the initial plan is never the same as the final plan. And that when people get stuck in being unable to adapt and to move forward as the external realities impinge upon their initial plan, they don't succeed, they don't move forward. And so we've really started to talk about very much this issue of your implementation plan at the beginning is genuinely the tentative one. It's your test plan, and you do not finalize that plan until you have executed your initial ideas, taken a look at the feedback, looked at the developments, looked at the progress, figured out where that's working well, figured out where you need to make adaptations and changes, and then you finalize that implementation plan. The idea that one can make an implementation plan in January, and that between January and the following January, let's say, there's no need for changes or adaptations is simply not realistic, with very, very rare exceptions. And frankly, I'm not even sure I could fill up one of my hands in terms of counting organizations over the last decade or so where they haven't had to make significant adaptations along the way as other issues became evident to them that they simply weren't able to see at the beginning of the process. And then there's, of course, the issue of funding and sustainability, which is a challenge for everyone. We look at this piece, and so first of all, you've got the issue of how do you move toward that? There's the issue of planning, looking at program evaluation. Public relations campaigns is another way to look at it. Stakeholder engagement is another component. A lot of times, I was actually in a meeting this morning with a DOC, a Department of Correction, and we were talking about this issue of funding and sort of back and forth that they were having with the legislature. And one of the things that the DOC, I think, that I was talking with, has not figured out how to do well is public relations. They sort of see that as a fake kind of thing, but in fact it's not. It's a significant piece of what they need to do. But what happened is that they felt like a lot of times the organizations, the governmental organizations, feel like we're better off not putting ourselves out there because mostly when anybody writes about us, we get attacked, and so we want to keep our heads down. It actually works the opposite of what it is that we want when we're looking for public support, public funding, for engagement from different folks. And so it actually doesn't get us what we want. It becomes self-defeating. And so when you're looking at the planning process for funding and sustainability, the program evaluation is having the data and the information that's important for people to look at. The public relations or marketing campaigns are not putting out fake stuff, but it is putting out the information in a way that people can understand, in a way that is bite-sized, in a way that is not full of lingo or things that the general public or folks who are not in our particular discipline won't understand. And that leads to greater and appropriate stakeholder engagement. And we'll come back to that. But the other issue about stakeholder engagement is that too often we define our stakeholders in too narrow a range. And we don't actually search out a broad enough range of stakeholders to really get the support that we need. And of course, there's the issue of just getting that funding, and there's the issue of sustainability, which means how do we get this to the long run? And we would argue that these components in this left-hand box are the three of the major ways that you secure ongoing funding and sustainability over time. It means that you have to stay attuned to the shifting trends that are going on and to work on maintaining the program as well as improving it. It means involving the entire program and intervention team in the work that is going on. So we recommend that, first of all, the goals and mission have to be clearly defined internally, and they have to be clearly explained to external stakeholders. It's important to involve key stakeholders and to find a champion. And those champions sometimes are the obvious ones, meaning a legislator or a significant official in the county or state government or city government or whatever. Other times those key stakeholders are actually not the ones that we would anticipate. Sometimes key stakeholders that can move us forward are folks from advocacy organizations, from community organizations, from employment organizations, meaning regular employers out in the community. There are lots of different ways to look at stakeholders, and we have a tendency to have too narrow a view of who our stakeholders are. So one of the things that we would encourage, and that I think your coaches will be pushing you on as you move forward, will be to expand your sense of who stakeholders are and how you can involve them in moving you forward and assuring sustainability. Of course, that includes building cross-agency collaborations that at least 3 or 4 of you on the call earlier have talked about doing, and that's one of your goals, so it makes perfect sense. And there's the issue of collecting data to make the case for sustaining the program over the long term. I want to make a quick point about that issue of data collection. There are a few different things to think about in terms of that, and the one is, a lot of folks don't collect good data, but then I also know a lot of folks who do collect good data, and I know that several of your organizations, without a doubt, collect very good data. The second problem that we see, though, is that people collect the data, but they don't have a good way of getting that data out. And so it's going into the massive funnel, but it's not coming out in a way that's useful. And so you really have to examine that. And then the third piece is, even when they get it out, so now we've lost say 20% from the beginning, and now we've lost another 20% of the organizations in terms of getting it out. What we then find in terms of a lot of the remaining organizations is, even when they can get it out, they have not learned how to present it in a way that is marketable. They have not learned how to present it in a way that what I call regular folks can understand and make sense of, and then get on board in terms of supporting the goals of the organization that is asking for their support. And of course, the last thing, and the equally obvious thing, is the issue of, it's important from the very beginning to be identifying potential long-term funding streams. And obviously, in many cases, those are governmental funds, but in many organizations, many police departments, many human service agencies, many departments of correction and probation and judicial departments, they very much seek to augment those funds, whether that's through federal dollars, whether that's through private foundations, or other research grants that are out there. It's important to think broader than the government funding that our organizations may indeed have access to and typically get. Which leads us to that issue of leadership, which is that it's important that leadership be committed to long-term involvement with the program. There's, of course, the issue of the support from the key stakeholders in the community that I was mentioning, and among the relevant agencies and providers, and a champion who can publicly advocate for the continuation of the program. Back when I was doing services in the community, I had a collaborative relationship with our judicial system and with our victim advocacy system. And one of the things that we learned over time was that we were advocates for each other's programs rather than going out to be advocates for our own. And so when you're looking for a champion, you want to look for champions that are not necessarily within your organization, not that you shouldn't have those as well, but you want to look for champions that are external to the organization. The other important thing about the mission statement and the goals and the objectives being written very clearly is the issue of leadership, and you've got 2 issues with leadership. The first one is, of course, they have to be on board to begin with, but the second thing is that for many of the kinds of organizations that we deal with, there can be relatively significant turnover among leadership over time as governors change, as other sort of political winds happen. And so when you look at the issue of leadership, you need to obviously be starting at, is top leadership committed? But you then have to make sure that middle leadership is committed, because you'll have much less turnover among middle leadership than you will among top leadership. And if that middle leadership remains committed Typically, when the new top leadership comes in, the first thing that they will do is get a good download from middle leadership about what's going on and where are we going. And it will definitely increase the potential for the long-term success and sustainability of the process and the plan that you have developed and are working on. Cross-agency collaboration also helps do this. We want to make sure the relevant treatment and justice agencies are involved with collaborating on the program, and I heard a couple of you talking about that very much being your goal. You want to make sure that there are developed formal interagency agreements that are in place, and it is really important that those be written, not just verbal. It is fine when we have good relationships with our sister and brother agencies, but the reality of it is there really need to be very specific and formal agreements in place so that, again, as personnel change, one doesn't lose what's happened. And of course, the sort of second piece with that is particularly when we're looking at that intersection of treatment and justice agencies, we have to be very careful in terms of looking at issues that have to do with confidentiality and privacy, et cetera. So it's very important that we have those things written down in an appropriate way, and we have a clear policy instead of procedures that we're using, not just internal to our organization, but between our organizations. It's important that the various organizations be adequately involved in program design and the implementation and the evaluation as opposed to simply being told this is what the plan is. And you always want to look for opportunities to integrate the program into other key program areas that might already be in place in other agencies. Recently, some work with Wichita Police Department in which that's exactly what they're looking to do as they're building and looking at dealing with their homeless population and their transient population, for example. In terms of looking at demonstrated outcomes that you are able to give to folks for that support, you want to look at what data exists that can be used to assess program effectiveness. You want to look at what data that you should be developing to assess program effectiveness. You want to see what other information can be used to support the need for and the effectiveness of the program, and that includes very much stories, personal stories of individuals who have been helped by the program, whether that is as extreme, if you will, as their lives being saved or it is their lives being improved. Whatever that might be, you want to look both for the hard numbers and you want to look for, if you will, the soft stories that people very much want to listen to and helps people understand why the programming is important. You need to be sure that the findings have been written up in an easy to read format, and that's something I am always harping on. As I've said 3 times already, it has to be understood by people outside of our disciplines. And you want to make sure that those outcomes are then clearly communicated to stakeholders, collaborators, and to potential funders so that they have the information necessary to provide ongoing support to you. In terms of marketing strategies, you want to look at what's available, what can be developed that would help to disseminate information about the program. In some cases, those are paper things. In some cases, that's social media. In some cases, those are websites or any combination thereof. Could also be community meetings, and frankly, should also be community meetings. There shouldn't be one product or one strategy. It should be a multiple set of strategies. Not every organization can do all of them because of resources. You do as many as you can, and you determine which of the strategies you can do will have the biggest impact. So if there's 6 options and you can only do 3, determine the 3 that will reach the most people most effectively so that it has the biggest impact. You want to make sure that that target audience has been marketed and has been identified for any marketing efforts. And what that means is that you may have different approaches depending on the different audiences you are targeting. So if you're using pamphlets, for example, the style of your pamphlet and what that looks like may be different than your social media campaign, or it may be different, and it will certainly be different than the report that you're perhaps giving to the legislature or the county commissioners or the mayor's office or whomever. And that needs to be developed as a definite, solid marketing plan. Meaning it can't be by our bootstraps. It has to be, this is what we're going to roll out. These are the time frames. These are the specific products and ways that we're going to do it. And this is how we're going to measure that we have gotten it done, that we have completed those things. And for those of you that are in particularly larger organizations and may have the data capacity, you should also be building in a metric to measure impact. in terms of the impact of the different strategies that you've used. And you can build those metrics by looking at dollars, by looking at supports, by looking at hits and likes. There's a variety of ways you can do that, again, depending on the resources you have available and the technology that you have available to you. To you. In terms of planning for funding sustainability, 3 big components, not surprising, again, I'm sure to most of you. Analyzing funding needs, what are the true costs of the program, and that includes costs like not just salary costs, not just the overhead costs in terms of fringe of those things. It includes the things like physical costs for buildings, for furniture, for cars, for equipment. All of those things have to be put in there. You need to make a determination about which are one-time startup costs versus which are ongoing. And you need to consider everything, as I said, services, treatment, staff, supplies, IT, which in fact I had left out earlier, but IT, and what other supplies are necessary to assure that you have the ongoing data collection capacity that you require to really make your case. There's the issue of identifying the various funding sources, federal, state, county, private foundations, donations, program fees for states that have Medicaid expansion, Medicaid and other insurance opportunities for states that don't. There's, again, a variety of different ways to look at that. Don't just focus on the main funder that your organization may have, your city, your county, your town, your state, whatever. And then the strategies, right? What costs can be covered by insurance and benefits? What funding sources are restricted versus which are more flexible, and how do you determine then how you route the various funding to cover your different components of what you want to do? And what funding sources can meet which particular program sources? So those are sort of 3 things, and they need to be thought about at the very beginning. One of the reasons that we add this to the strategic planning discussion is that too often people start thinking about sustainability at the end of the planning process, or frankly, even halfway through the implementation process, which is way too late. It needs to be started at the very beginning in terms of thinking about that long-term concept. You can't just think, well, I've got 2 years of funding and I'll worry about it at the end of those 2 years. So overall, the supplemental funding strategies described really sort of do 5 things. They really focus at providing funds for sustainability. They help provide bridging services between the institution and the community until Medicaid or other benefits can be obtained. They help broaden the target population, perhaps by expanding diagnostic or functional categories that are served. And they help supplement existing community services where there are capacity issues, so that becomes an important piece. And then finally, there's the issue of looking at, through donations and other kinds of gap funding, how you pay for services that are not available from Medicaid or other health insurers. Again, I was just in Wichita last week, and I was amazed at the amount of funding coming from the local community citizens to support a variety of things in terms of housing and food and other supports, that they have done a very good job of engaging the community and getting those supports through non-governmental funding or non-insurance funding. So there's a variety of different ways to approach that. There shouldn't be just one approach overall. So with that, and again, fairly quick overview, and the idea being that we share a common language. In no way do we want to suggest that any of you have not already been engaging in a variety of strategic planning processes over the years. But hopefully this will help keep everyone on the same page. It will give your coaches and you a common language. It will allow you to think about this moving forward. It will help make sense in terms of some of the processes and if you will, demands or requirements that come with the grant, and hopefully will increase the success of all of your projects. With that, I will turn it back over to, I believe, Laura, and thank you all for listening.
Thank you, David. Thank you so much. This presentation will be available to the grantees after the presentation. So just reach out to your TA coach, and we'll be able to get you a copy of this presentation, David's presentation. So thank you again, David. Thank you for your help. Really appreciate it. I will now turn over to Jessica Murphy. She is the co-responder team leader in Johnson County Mental Health Co-responder Program in Kansas. She is a former grantee who is able to take the co-responder program past grant life, and she has been a great asset to us here at the GSC, just connecting to other grantees. So, Jessica, I turn it over to you.
All right, thank you, Laura. Thanks for this opportunity to join you all this afternoon. So full disclosure, I am at home. I told them this earlier, and I'm fearful my dog is going to start barking at any moment. But I was on call overnight, so this is just what worked out best for me. So if that happens, I apologize well in advance. So as Laura mentioned, I am the supervisor for our co-responder program here in Johnson County, Kansas. I've had this role for about 3 years, but been with the county for 13. And as Laura talked a little bit about how we started as a grant, and I actually inherited this program past the grant, but am knowledgeable about the experiences we had and the steps we took to take them us past the grant that we were awarded. So just kind of an overview of Johnson County, because I know you guys are across the country, and I think it's important to know who you're talking to and what it looks like, because this program can be scaled to meet small needs and large needs. And so I think that's important to highlight. So we are right here on the border of Kansas and Missouri, and in fact, we get a lot of Missouri residents that our officers will have contact with. And so, because again, that state line is something that is passable, so people will go both sides. Our metro is about 2.1 million. And then in Johnson County, we're close to 600,000. And that actually swells in the daytime because we do have areas where people will come. Overland Park is one of our cities where we have a large population of daytime traffic. The square miles for our county just again shows it's a pretty large county relative to others in our area. So we do have quite a bit of coverage. With that, you'll see we have 20 cities, 17 municipal and county law enforcement agencies, one of which is our county sheriff. And then we have a variety of small police departments to our largest, and I have a map here in a few slides that will highlight that as well. We've got 1,100 jail beds. Average daily population is about 760, and I've learned that that's about 50% Johnson County residents and 50% are out of Johnson County. And then we have 6 medical centers and 6 school districts. So all of those stats, again, I think are pretty important. In addition to those 6 medical centers, we do have 1 psychiatric hospital in our county and that's connected to a medical center, and then 2 that are freestanding. So one is a geriatric psych and one is adult. And then we also have a juvenile freestanding. So again, just a little context to our county. Johnson County Mental Health Center is the community mental health center for Johnson County. In Kansas, it is a state requirement that every county have a community mental health center or have a connection to one. And some counties will actually share one. We do not. We just house and support in Johnson County. This gives you a little bit of insight to our budget, because again, I think that this, similar to what David was just talking about, this is important to know what our budget looks like and how that will scale for yours. So the mental health center has nearly 340 full-time employees. We do get funds from state and federal, but we also have a large support from our county budget as well, which is not the norm in Johnson County or in Kansas, but is for us. So we're very fortunate to have their support to us as well. On average, annually, we serve about 10,000 individuals. At any given time, it's about 7,000 people, but the extra 3,000 includes those that get open and closed. And then for our crisis services, it's about 5,500 residents annually, and that number is from 2018. So I imagine that number has gone up actually in 2019 as we have grown our emergency services division quite a bit here. So I'm sure you guys have all heard the term co-responder, but I think it's, again, important to kind of review what that is for Johnson County, because as a program that has talked to other co-responder programs across the country, it looks different everywhere. And again, that's what I actually appreciate the most about this type of work, is that you can modify it and individualize it to meet your community's needs, because we are not all the same. It's not a cookie cutter program. You really do need to make sure that you're meeting the needs of the community and the agencies involved. So for us, it is one of our licensed clinicians. They are employed at Johnson County Mental Health Center, who I was just talking about in the previous slide. However, they're stationed at the police departments. So they get their paychecks through us, benefits through us. I supervise them as an employee of Johnson County Mental Health, but they go day in and day out to the police departments. The picture you see here is actually one of our former programs that I'll talk about here in a bit, and it highlights the Northeast program. The front person, woman, is the co-responder, so that's our uniform, and then the rest were the 7 police departments she worked with. So this was kind of to give the visual of the collaboration that was happening. Each of those officers is from a different police department, and they all shared that one co-responder. Like most co-responders, I believe, we have a police radio, work cell, work vehicle, and then the nice thing for us is that we are truly liaisons between the mental health center and law enforcement. So we have access to Johnson County's electronic medical record, but then we also have access to the police records, which our system is called Niche. So they are able to pay attention to both sides, and that is really, I think, what is pivotal for the success in our area, because they can look up reports and notes in each side of them and make sure that the other side knows. So they're really the communicators between the two. So this is the map I was referring to a little bit ago. This is a link that we would be happy to share with anyone that is kept updated. We've made it for our community and for presentations like this because we want people to have the visual of what it looks like in Johnson County for our coverage. So I mentioned we have 17 law enforcement agencies. We actually work with 15 of those. The gray areas are ones that have not yet gotten involved in our co-responder program. There are smaller cities, and we're still talking about how we can make them or get them to be involved, I should say. All of these, the different colors are different cities, so different law enforcement jurisdictions. When you see the 2 below it, that means that we have 2 co-responders there in those cities. They all started with 1 and have grown to have 2, and that is strictly from data, that we have been able to demonstrate from our data that there is a need for more. I would love to tell you that we started out with 11 as we have today. That may have been easier, but again, it was just adding 1 at a time, and then a new city would come on and it would continue that evolution process. You see over there on the left-hand side, I also have the hours of the operations in each city. When we have what we call a single co-responder, so 1 co-responder to that city or program, they have what we call a stacked schedule. So it starts out evenings in the beginning of the week and ends in days towards the end. And I have a slide later on that I'll kind of talk about that. But then the 2 programs, we have at least an hour worth of overlap. In Lenexa, we just launched our 2nd co-responder, so we have 2 hours of overlap there because we really found that that's helpful for the training of the evening or new person to have. Up in the top right-hand side, you'll see Northeast, so NE, and that is actually 5 police departments and 7 cities who are collaborating for 1 position. And same thing, that LPV is Leawood and Prairie Village. Those are 2 of our cities and or 2 police departments who cover 3 cities, I apologize, and they share a program. Those 2, the brown and the green, actually used to be 1 big program in 2017. And again, I'm going to talk about that in a few slides with some pictures, but I just wanted to highlight that real quick. The lower left-hand corner, you see GESD, so that's Gardner Edgerton School District. And we highlighted that differently because that is our first ever school co-responder position. This is brand new in Johnson County. We launched this in 2019. And actually, this is our smallest school district that is doing it. And it's been a really interesting process to work with school administrators versus the law enforcement commanders. But she does not necessarily have to partner with law enforcement, but is partnering with the school. There are times when the school resource officer or the local law enforcement does get involved, but it's another way to try to eliminate having that law enforcement contact because she's handling those crises that are happening at the school, helping the school officials. And to be fully transparent, we've helped some of the staff out there as well, including an involuntary committal, which was not something we foresaw coming. But again, we just want to help folks and do what we can to get everyone the right treatment when they need it. So this is a little bit, I think, of the journey you guys are all starting on. I think the timeline is important to highlight. So we started out in 2008 with our Criminal Justice Advisory Council, CJAC for short. And that is what, again, Dave was talking about, of bringing together those stakeholders, the key people that you have in your community that is going to help champion and cheerlead and propel your goal forward. So that is made up of kind of our high-ranking officials. So we have a lot of chiefs or deputy chiefs that are in there. Our sheriff attends. Our district attorney attends. The director of the Community Mental Health Center attends. So it's really, again, those folks who are our decision makers who come together and they meet quarterly to talk about things. And that even started in 2008, but it continues today. From there, that they decided that they needed to get essentially a sequential intercept map and identify where Johnson County falls on all of the intercept points. If you're not familiar with the Gaines intercept model, that would be something I would highly encourage. I heard someone at least reference it, but it is a very valuable look at your community, and you can find where you're doing well, but then also where the gaps are and identify some valuable goals. So through that, we were able to find that we had, again, many gaps, but one that we wanted to focus on is now called Intercept Zero, where you focus on the law enforcement contact. Because if we want to keep people from getting into jail, let's equip them on the front end with the officers. So we went for the same grant you guys are all awarded, and we were fortunate enough to be granted that back in 2010 with our city of Olathe. And then we launched there shortly after, found out that was going to be a success. And at that time, they had expansion grants available. I'm not sure if they still have that. Laura would be able to clarify that at the end. But they did at that time, and so we were able to get an expansion grant to move into Overland Park, which is our largest city, and focus on growing us further. This isn't on the timeline, but shortly after that, again, for us, it was one of those when one city finds it successful, then it just kind of caught on to the other cities. They asked for another expansion grant, and at that point they said, nope, you guys got it. You know what you're doing, which was evident. We, had already been able to start up 2 successful programs. And so that's when the two chiefs pulled together and said, let's have a joint program. And that was the very first time we did that back in 2015 with Shawnee and Lenexa co-responder program. So today we have 11 fully funded programs. Now I say fully funded, I have a slide about that, and it will break down the budget that we have here in Johnson County. I'm going to back up this is just one slide. One thing I wanted to mention here too, so you guys are aware, so Overland Park is our largest city. There we have 250 officers, 120 or so are patrol, and they're about 50% CIT trained. And then I'm going to focus more on the northeast, the green side up top, because I think it's really important to highlight a shared program. Their largest city in Merriam has 20 officers on patrol, and the smallest has 5. So again, I think that's important for you guys to see that this is something we have scaled to large with the 250 there in yellow, all the way down to how can we help a smaller department as well. So this is what program startup looks like for us here in Johnson County. Again, Dave touched on this where it talked about getting things in writing. I will tell you this is my least favorite part of having a program, but it is really critical to success, and that's having the memorandum of understanding. It is thorough. We have risk management and legal involved, so we are fortunate to have those folks bouncing ideas back and forth. I really just review it to make sure it is consistent across programs and to make sure the clinical stuff is taken care of, and nothing stands out. But this is something that we have on the front end before we get the program started, and really it just highlights what's going to happen for billing, who is in charge of the program if media requests come up, things of that nature. It just goes into it, and it does talk about the budget as well, to make specifics about who's going to pay for the pants, the shirts, the radio, laptop, those kind of things. Before we start programs, we have done a pre-survey to all of the officers who are going to be involved, and I have some results later on about that. But this has been really important for us because you can collect data all day long, but your data is from your contacts. So did I divert from the ER? Did I divert from an ambulance? So on and so forth. But you also need to be able to demonstrate the impact you had on the officers, if they liked it, if they find value in it, because that's also really important for growing and funding a program. We want to be able to demonstrate that we moved that culture and that dial of mental health friendliness, if you will, further. And again, through our program, we have seen that with our results, and I'll talk about that further. We review the police department's mental health policy. This is really important because, again, we try to focus on consistency. I have 8 programs that I work with, so 12 different chiefs, 12 different cities, and we try to make things as consistent as we can. For those of you that don't have that, I still think it's really critical to review the protocol that they have in-house and make sure it's updated, because that is something we learned we were not doing. And we bring in a new program with a co-responder, but the protocol's outdated and doesn't include the things that it needs to highlight the success and to focus on successful programs. So I would encourage doing that from the beginning, or if you haven't done it yet, to sit down together and kind of review what makes the most sense. If you guys need help with that, we would be happy. I can reach out to one of my colleagues on the law enforcement side and see if we could possibly even share one of the policies that they have as well. Funding, it is probably one of the most important parts and also can be one of the harder ones. So our programs are primarily funded by the cities. There is funding that will come from the mental health center. My position is what we consider donated to the program because the mental health center does pay for it. And then we also use hospital donations. So we've had 2 hospitals that have contributed to our program. One hospital called the chief and said, we have $50,000 that we will give you for the next 3 years. What do you want it to go towards? And he said, I want a second co-responder. And so he, of course, $50,000 unfortunately does not cover the program entirely or a position entirely, but he was able to contribute to the rest of that. We actually, I should say, originally tried to do a part-time position, and that would be fine. It just had some challenges, so we decided to grow it to full-time and have the city pay up the rest. And then alcohol tax funds, that is something that we've used, and I'm not sure that it's something that people use across the country or not, but I really find that to be valuable if it's something that you have access to through your cities, to see how to do that. And for us, the thing we needed to do was make sure in our data that we collected how many had substance abuse currently in the picture or even historically in the picture, and have been able to use those numbers and percentages to help support using alcohol tax funds. So this slide here goes a little bit deeper into the budget, as I had mentioned earlier. You can see on the left-hand side and the right-hand side, or the left-hand side, we're going to talk about what the cities and police departments pay, and then on the right, talks about what the mental health center pays. I realize now I forgot to put the center of the chart in, and that's essentially talking about the conferences that we both will pay for people to go to, and just little things that kind of come up, and we just figure those out together. So on the law enforcement side, they pay for the pants, radio, and then the computer and printer that they need from the police department side, because each of our programs, you're going to have a police department computer and a Johnson County computer. We do have one city that they've been able to figure out how all of it can get on one computer, but I would say technology is one of our harder avenues because you're having to have 2 completely different departments and areas work together, and that can be a challenge. Reoccurring from the city comes from the salary and benefits, so we will bill them quarterly typically. We have a financial department who will send that bill for them to pay on a quarterly basis. That does include the cell phone and car. So we require a designated cell phone that is separate from a personal cell phone. That was a lesson learned for us. We did not do that originally, and officers are 24/7. Our co-responders are not. So officers are still calling, when they have these mids calls, and it it wasn't enough separation for the co-responders. So now we have a specific work cell phone for them. 2 of our cities actually provide their own cell phone in a city car, so we don't bill them for that, of course. If they do not want to do that, then we lease vehicles and bill them for those as well. So on the mental health center side, we provide the shirts, and the reason we've done that is because it has our logo, and so it was something that we said that we will contribute that. Our computer and printer, and then the supervision is reoccurring that they receive from myself and colleagues at the mental health center. So recruitment, I'm not sure exactly who's in this stage or has been there. At least in our metro area, it is getting harder and harder to recruit for clinical positions. And that's not what this webinar is about, but I feel for anyone who has those same difficulties. So we have, though, a series of steps we have to go through for a co-responder position, which is different from most mental health center positions. We start, of course, we bounce the job posting back and forth between myself and the captain so we can make sure we're all on board. It's now that we've hired, 15 co-responders at this point, we have a pretty set job posting. I, again, would be happy to share that with anyone who might like to see that. But we always post it on our website, our recruiting site, and that is where people will apply because, again, they are employed by Johnson County Mental Health Center. However, we send links to the law enforcement side, and we ask them to advertise as well on their social media sites because most of our police departments are pretty active on social media, so they will send it out so that people can see that online. We do joint interviews, so we bring together a panel of both law enforcement and mental health center staff, usually me and my director, and then a sergeant and captain will sit in on those. Once we select someone from interviews, we'll do a ride-along with law enforcement officer. That's about 4 hours, and then we will do a shift with a co-responder, anywhere from 4 to 8 hours. We didn't do that originally because we didn't have access to enough co-responders to do that, but we've added that in the last 2 years. And it's critical for us because, again, for recruitment for us, it's typically 2 months on average because that last step you can see they have to do a police department background check and polygraph. So not only are they doing our background check and our reference checks, but then a police department is going to do the typical background check that they would do for any of their officers and the polygraph. We have lost a handful of applicants through that part of the process because just various things that come up. And so I want them to see that right along with the co-responder because I need them to know what they're getting into. We can write a very thorough job description, but we've all been in the place where then you get into the job and it's just a little bit different than what was described. And I don't want to get through this entire process and lose someone because they didn't realize what the job was. So we added that into our process, and it's been really successful and helpful for the applicants to understand the program better. So I mentioned this on the map slide as well, and I won't go into much detail, but I will say we originally started when we had single co-responders. It was Monday through Friday, 2 to 10, and that was pretty standard, and that's because that's when the highest call volume is for our mental health calls for service in Johnson County, and nationally that's typically the higher time frame as well. However, as our program has grown, and I had mentioned the recruiting difficulties we have faced, we decided to try a staggered or stacked schedule, which is over there on the left-hand side of the screen. And there's a lot of value to that. One, it has helped recruiting. We've gotten really solid candidates that I don't believe we would have gotten if we just had standard 2 to 10. But it also helps with connecting with clients because, while we're not always out on that 911 call, sometimes we go out after and do an outreach. Some people are at work during the day or some at school, kids at school. And so we can go do those outreaches on Monday, Tuesday, or Wednesday. On the other side of that, some work evenings or mids, and they're going to be at home during the daytime, so we'll hit those folks up on Thursdays or Fridays. So we can really make a difference by figuring out when we need to go out and see somebody. But it also helps the police department culture, which will come out again when we do our post survey, because we're no longer just working with the evening shift. We're going to work with days. We might even have a little overlap with mids if they come in early enough on those Mondays and Tuesdays. So we have found that to be really valuable. Now, if we have multiple co-responders, then we're going to have, we've stuck with Monday through Friday. Part of that, again, is to help with recruiting, but then we have at least an hour to two with overlap. So one thing we also do is I have some ideas down there of other things of splitting with weekend coverage. So you could have, where they work Sunday to Thursday and, Tuesday to Saturday or whatnot. Again, we've chosen not to do that. However, there's so much flexibility. If one of my staff needs off on a Tuesday, I am willing to let them work on that Saturday or Sunday to make up those hours because the work is there. It's always there. It needs to be done. And so I'm happy to do that. If they want to take a vacation day and not make it up, that's okay too. But we try to be flexible with our team because it also helps the police department as well. Co-responder training. In the last, I would say, year, we have really focused. This was one of actually our strategic plans in 2018 or 19, I apologize, of saying how can we make this better, because we knew we were going from 5 co-responders to 6 in 2019. I hired 6 within that year, and so we needed to become more proficient with it. So our first 2 months of employment, once we've hired the individual, is pretty rigorous training and focusing on getting them to know the job, both the mental health center side of things and the police department. We do more ride-alongs with officers and then a lot of field work with the other co-responders. So they're spending shifts with those co-responders that they will go out on calls, take lead on calls, and have that reverse shadowing opportunity. We have checklists, and I don't believe I have them included in this presentation, but again, I'd be happy to share those with you all, that we developed to make sure we are having consistent and quality training. And that is something that was important because historically people would just kind of jump into the job and get dumped into it, which is fine. They did well and were successful, but we just wanted to have a more quality approach to it. Now that our program is big enough, we've also launched a co-responder mentor program. So my 5 senior-most co-responders are mentoring the new folks that have come in to just be there for questions, to check in, and kind of have that relationship building, because as you saw by our map, we are all spread out. No one co-responder is going to work a full shift with another co-responder at this given time for us. And so we need to have those relationships built. Then once they go live, I do shadow them for 3 shifts at least, and we'll be out with them on 911 calls, help them with reviewing police reports and monitoring the radio, things of that nature. That's been really important as well. I have learned that none of the team really enjoys that because no one likes their supervisor there with them, but I'm not with them day in and day out. So I want to make sure that, again, we have quality co-responders going into the field because they're doing really important work on these calls, but we need to make sure it's quality, and you don't have someone there watching you to make sure that's happening. So we try to do that on the front end. And we've also started this year, one of my goals has been I will spend 1 shift with 1 co-responder a month at the very least. So that seems small probably, but that is something that I'm at least trying to do, so it will help me to maintain that integrity with training. Oh, sorry, I zoomed in on you guys. There we go. So goals of our program. So I started talking about the recruiting, and now I want to get into more of the nitty-gritty of the program. Of course, suicide prevention, that is something that is important to all of us across the country. Avoiding ERs, that is a big part of it. So I'm actually going to jump to avoiding jail. When we started back in 2011, the goal was how can we keep people out of jail? And that's, again, the Stepping Up initiative and the sequential intercept mapping, and it's focusing because those folks with mental illness are ending up in jail. They're staying in jail much longer than the general population. They have to go through competency restoration, and all of that is expensive. And so it's also not where they need to be. So how can we focus on that? We have found that we've not been able to make as big of a dent in that just yet as we would hope, and we're still working towards that. We do have times where we have jail avoidance, but there are laws that, of course, are mandated arrests, and so that's not things that we can always overcome. So we've grown that to say, how can we avoid ER visits that are unnecessary? And as someone who used to work in an emergency department here in Johnson County, I can think of countless times I would assess an individual brought in by law enforcement that did not need to be there. I was simply going online and finding therapists in the community that would meet with their insurance. It was not something that was an emergency medical situation. it was not needing inpatient treatment. And so that's an expensive service to provide these individuals. And you either have people who are uninsured, underinsured, or still their copay may be $100 or more. And if we can do that for free in the community, that's what our goal was to do. And then the last thing there that we wanted to do was try to reduce repeat mental health calls for service. Again, I think this is probably a duh for everybody, but it's one of those, we know that people know how to call 911, they know how to go to an emergency room, but we want to make sure that they're getting the right services. And so if we can do follow-up as well from those 911 calls to make sure their needs are met, then we are hoping that we're going to reduce them repeatedly calling 911, and they may call the co-responder or our crisis lines instead. So co-responder responsibilities. This is just a quick overview and definitely not all-encompassing of what our programs look like, but our primary goal is that 911 response. So we are going to go out on the scene with officers when we're on duty, if we are able to. I put on there secondary responder. This is critical to be paying attention to, in our opinion, because we are not first responders. We are not wearing bulletproof vests. We do not have belts with all the gadgets. We are secondary responders. We are going to come out to a scene once it is determined safe by law enforcement. And I say that because we've had stuff locally that has come up where they had said that a tragic incident would not have happened if the co-responder would have been there. And that's not the case. Co-responders are not going to always be able to be involved from the beginning. And again, we're usually earliest we're probably getting there is 30 minutes or 15 to 30 minutes into the call because it needs to be safe. Now, when we are listening to the radio and we know that call's happening, we can start driving that way and monitoring radio, and we will stage. We will let the officers on scene know, I'm staging a mile back. Let me know when it's clear and I'll come on scene. We do that for the efficiency's sake for the officers. Reviewing police reports, of course, co-responders are not on duty all the time, and so we have a system where the police reports, they collect data in their reports as well on our systems. So one of them is, the data points is, was this mental health, yes or no? And that is the only required checkbox in our county's record management system. We advocated very hard for that when we went live with this system last year, because mental health is a big deal in law enforcement across the county and country. And so we needed to have that data be specific and consistent. So once they check that box in our system, it gets linked automatically to our co-responders for them to review. They will look it up to see if that individual, we'll say Jessica Murphy is the client that they're reading about. They're going to check our system on Johnson County side. Is this a client? And if they are, make sure they notify the treatment team who is involved so that they're aware of the call and can do quick follow-up with the client they're working with. If they're not an open client, then we will take lead on those individuals. We will either do a phone call or we will go knock on their door with an officer. And we try to triage that for a variety of things. I don't put this in writing because I really trust the clinical judgment of my team. And so what we say is, how urgent is it? Do they even have a phone? Do they even have an address? So those are, of course, going to change your outreach opportunities. The picture there that you see on the right-hand side is what we call our door hanger. So we have tailored this to Johnson County and to our co-responder team. So if they are not at the home, we can leave this. And it's only one-sided, so we put the print side on the front or facing the door for confidentiality purposes. And we will staple our business card to it as well. If they are home when we go out to the house, we will give this as well because it's just easy information right there that talks about what is a co-responder. If you want to get an intake with Johnson County, here's how. And then our 24-hour crisis line, which is, again, something that we would love for people to get more comfortable with using versus 911. So the last two things on there is the liaison. I've talked about that already, but then training for officers is really important. So we're all familiar with CIT and the 40-hour training that often goes along with that, and that is very helpful and necessary. But the co-responder program is taking that to the next level, past CIT, where we're doing the training in-house, in-service training specific to what they're needing, and we're getting the entire patrol, not just the ones who are sent to be CIT certified. We are also able to do more of that kind of accountability training. It's countless times that we'll have an officer pop by the office and say, hey, did you get that? Please report on Jessica. I'm worried about them. Are you able to follow up? Because they care. Even though they have to stop the 911 call and they have to go to the next one, that doesn't keep them from worrying or thinking about what's going on to the citizens in their city. And so they want to make sure that we are able to do some follow-up from it. Or if they missed an opportunity to get someone help, we have had times where the officers have cleared the call without an assessment, and so we're able to follow up and let them know why that would have been important. And again, just more of that accountability training that is helpful. At the bottom, that's the motto that we've come up with for our program, and that's the right intervention at the right time by the right person. Because again, we are making sure that it's not the officers making sure they aren't suicidal. It's bringing out that clinician to do those assessments, and it's really a more trauma-informed approach. If officers have to take someone to the emergency room, not only is that, of course, expensive, but you're going to have to go through the person's bags that they're bringing, or they might have to be handcuffed. And those are things that can be traumatic to people. And so if we can bring those assessments to them instead of taking the citizens to the assessment, we're just, again, providing a better service to our communities. So this is the extra things that we do, and again, not all encompassing, but I think I just wanted to highlight a few for you all. One thing that we started just this year at Johnson County Mental Health is a COP culture training. So I think of this as like a reverse CIT. We have where, again, we have nearly 340 staff at the Mental Health Center, and they will go out on a call with officers or call officers to a home if they needed help. And there are frustrations that happen, and we've learned that it's really from a lack of understanding what it's like to work with officers. My team and myself gets a front row seat to that because we go to the roll calls and we have daily interaction with the officers, so we have a better understanding of that different culture. And I'm using air quotes that you guys can't see, but that's exactly what it is. And as clinicians and mental health professionals, we pride ourselves on being culturally competent. And we also need to make sure that we're aware of the COP culture that's out there. So we've gotten fantastic reviews from the times we've done it. We've had someone tell us that this is the best training they've had at Johnson County Mental Health. Granted, they don't like all the documentation trainings and whatnot they have to go to, but it's refreshing to know that there's a training that they're enjoying to attend as well. Follow up about LEO, I already kind of talked about that. We have started working with our municipal courts as well, where we will get involved with the city attorneys and the judge to talk about a kind of individual, a loyal customer, if you will, who keeps coming through the system and trying to strategize ways. We have a couple cities that have mental health diversion, but not all of them, so we will try to get help when we can through the co-responder program. We've also been called into the courtroom when someone's there, and if they're having a crisis, then we will go in and help if we're on duty and available. We present at most of our citizens academies as well here so that the citizens are aware. Anytime we can present, we will do it. Last night I was a part of a symposium with Overland Park where we had citizens come and we presented on our CIT programs, co-responder programs, and mental health diversion, and then had a panel. And so that's an area where we are trying to figure out how can we make sure our community knows about this as an option and resource for them. And then the bottom one, another kind of lesson learned for us, we have evolved from just focusing on mental health, which is really what co-responding was originating with, and what, of course, the Mental Health Center is here for, but focusing on behavioral health. And that is where we're going to bring in our folks with intellectual disabilities, traumatic brain injuries, dementia, because they present as a behavioral health, but they are organic. And we can still be helpful. And we've also kind of grown towards social services. So if someone's in crisis, that does not automatically mean they have a mental illness or need mental health treatment formally. But it often means that they need a quick check-in or some resources to help them resolve things. And so our informal motto is if we can make a difference, then we're going to make that effort by either a phone call or going out to the house or out to the scene. So I talked about one of our goals being suicide prevention on the earlier slide. Unfortunately, in Johnson County, we do have one suicide every 4 days, and it's a very somber topic to talk about, but we have a bit of an epidemic, is what I call it, in Johnson County. We have a higher average than our state. And so it's something that we have really focused. And I will say in 2019, we had about, I think it was 20 less suicide completions in our county. And while we still had 80 too many, it is good to see that it is trending down, which is exactly what we want to see. So what we've done, we've always tried to do something helpful from this tragic incident of suicide completion. And so historically, we have called or gone out to the house of those who have survived. We do not go out on active scenes. I say that, we've done that a couple of times, probably a handful, as recent as even last night. But I really try to protect my team from secondary trauma as best as I can. So I try to keep us from doing those as often as I can. So what we've decided to do is we have partnered with our local support group, the Suicide Awareness Survivors Support Group, SASMO CAN there at the bottom. And we met with their board members. It was an incredible experience. We even went to one of their support groups and talked with the individuals there to really learn what we can do to be more trauma-informed and more supportive to our citizens. So we developed a new protocol that we launched over the summer here in Johnson County. Once we learn about a completed suicide, we will take the card that you see there in the middle. Every police department in Johnson County has developed their own card, and we will add in that purple booklet that you see towards the left called SOS, the Survivors of Suicide booklet. The support group we met with, they said that they would have loved to have had that at the time that this happened, that it was the most helpful booklet that they've had. And those booklets, I think, like are $1.50 a piece. They're incredibly cheap. All of our cities have committed to buying them so that we can provide those to our citizens. We'd originally thought we were going to have the detectives take those cards or the booklets out with them to the scene so they'd be right there. We quickly decided that wouldn't be a great process for us because we couldn't keep track of who got one. And we also don't always know that it is a suicide until after the fact. And so we didn't want to create more trauma or grief by handing that at the beginning. So we changed that to put that in the card. You can see the picture has a sticker that we have added that has our crisis line as well in there. In the card, we have a handwritten note, and again, I can share that with anyone who might be interested in this, but it's intentionally handwritten so that that individual will get a card saying that someone cares about you from the police department and from our stance, and we want to make sure you're doing okay. We want you to have this resource, and just to tell them that we're going to be calling them. We've had a handful of people call us first because they get this card, they get the phone number, and they want to reach out to us. And that, I can't even describe how good that feels to have that happen. There are times, though, that people don't answer our call when we call them, and that's okay, too. But again, we call it on my team planting the seeds, and we are not the therapist that's going to work with them for months. We are not the people who's going to be by their side for the next 3 years, but we are always going to be there when they need us. And there are going to be times when they need us, but they don't want us, and that happens. But we are there to plant the seeds of recovery and support and let them know who to go to. I have a quick success story that I'll share. Well, I consider it a success rather, but we had a student die by suicide in 2017, and one of his friends got the suicide letter, and as clinicians, we were very worried about how that would impact this young man who received the letter. And so we were throwing all of our supports to the family and the kid, to the point where the mom finally told me to back off, essentially. And I apologized, of course. We weren't trying to be too much, but we wanted to be there for them. And so about 4 months ago, I got a call from her, so 2 years after the fact, saying, we need your help. We still have your information. We've tried all these things. It wasn't able to help. And so we need you guys. And we were able to rally. We got him in for an intake, and he's getting started in services with us already. So it's things like that, again, that we don't have to be there. And even I think my team can get discouraged when they're out there and the person says no or they don't want to. But we don't know what's going to happen a week later, a day later, 2 years later. And so that is important for us to all kind of keep in our back pocket. So back to this protocol. I apologize for my my side note, but the last thing we'll do with this outreach is a door knock with an officer. So we used to do this without telling people, and I feel like the biggest idiot in the world because I did not realize the trauma that we were likely causing these individuals. The last time they saw an officer was when their loved one died. And here we are with the best of intentions knocking on their door. And how awful would that be? Even if they're not home, they most likely have a Ring camera, as we all likely do, and they see it. And that will bring up so much grief and emotion for them. So, again, I hate that we did that for so long, but we've completely changed it to where they know that we're going to come. There have been a couple times in the last few months we've gone when they've not been responding to us, but more so because we're concerned. And I think if we're framing it that way by just saying, we care about you and we wanted to make sure you're okay, that's important, but we really try to make the citizen aware of our supports and that we're there. We also have heard from a couple people that they really appreciated the card first, that they called it classy. So it's also been a nice way for our citizens to see the union between mental health and law enforcement. So I'm going to go into a little bit of detail in the next couple slides about our Northeast position. I decided to focus on this position because it is different than what a lot of counties do, where they might have, again, one for an entire police department, but these are our smaller cities, and they knew that they wanted a co-responder but couldn't afford it as 1-to-1 ratio, so one co-responder to one police department. So they pulled together to share the positions. So in 2017 and 2018, we had the green components and the brown all combined into one program. I will tell you that was a bit of a disaster. One, I was a brand new supervisor, so transparently had no idea what I was doing and was kind of learning on the fly. And so that didn't help. And then you have 7 chiefs coming together to try to make decisions, a brand new co-responder. So there were so many learning opportunities for us there. We have since split the programs. The chiefs in the brown cities, so Prairie Village and Leawood, got together and said, we want our own program. And so they pulled out, and they have one co-responder. So it's for 2 police departments and 3 cities, because we have a small city, Mission Hills, that's in there as well. And then we have the Northeast 5. And so that's 5 police departments and 7 cities. And I'm going to show you some data, well, not on this slide, on the next one, to show you how that has been critical to our success. So here's an up-close version example of the map of the Northeast there, so you can see. You'll see how Merriam and Mission are kind of spread apart. Overland Park goes way up to the top of our county, and so they have a little bit of land through there. But these are the populations in each of these cities. So our biggest is Merriam with just over 11,000, and our smallest is Mission Woods with not even 200 citizens. So the 3 cities that you see on the far right-hand corner, those are all policed by Westwood Police Department. Westwood is the police department I told you guys about that has 5 officers. That's their entire department, 5. Merriam has closer to 20 in their patrol division. So you can see that the other 3 are going to be right in between there, between 18 and 12 officers. So all of those together are going to make kind of one big police department. This co-responder, Jen is her name, she offices out of our Merriam station, but it's a small geographical area, so she's able to get to all of them pretty quickly. She does do rounds where she'll go check in at the police departments to build relationships with them. We have quarterly project leader meetings where all of the captains up to chiefs will come together and we'll kind of talk and powwow on how things are going. So this is data that is highlighting just the months of June to December of 2019 and 2018. So the blue chart, I'm going to start with this is hard when I'm not with you guys, I apologize. So the chart on the left, we're going to start there, and that is just 911 calls. So anytime we handled the call in person or by phone, because sometimes we will do that as well. 2018 was when we had it shared amongst the 7 police departments, and 2019 is when it went down to 5. You can see we had a 420% increase on 911 calls in 6 months. That is staggering. When I made these slides for you all for this presentation, I sent it to my boss because I hadn't looked at these numbers yet, and it was just amazing to me what was happening. On the other side of the screen, we have the right-hand side is our ER and jail diverts. Our ER diverts went up to 973% increase. Again, that's 4 in the 6 months to 43. So when you look at those numbers, they're not as staggering. But we all know that there are times on those 911 calls that you can't divert from the ER. You have to go there because that is what's needed. And so there are those times. But it's over 50% of her 911 calls that she's able to divert from the ER, which is a nice number to have. So highlight a little bit of what's going well for our programs. There's so much. Again, I keep saying this is not all-encompassing, but really the relationships, I think, are what's critical to me, that we have those relationships with our officers, and they trust us to make decisions, and they trust us to be out there on the call with them and look to us as leaders within mental health. Even when we're not on the call, they will reach out to the co-responder or myself and say, you know, we went to such and such hospital and we had issues here, and we can iron those issues out. I started in 2017 the Johnson County Hospital Cooperative because we needed to bring our 6 hospitals into the fold. We need to all be allies, because if we aren't working together, then it's the person who's going to be losing is the citizen. And so we are trying to really build those relationships in our county. We have better identification of the behavioral health calls, because while our numbers go up with mental health calls for service, I also think part of that is they're better able to identify them, not just from CIT, but the ongoing support that they get from a co-responder. A co-responder might find the call, and I'll tell you one thing we started to do is we get a report every day, each city, that says all of the CAD calls that happened that day, and we will comb through them to make sure we didn't miss 911 calls. And if we did, we might go back to the officer and say, hey, you know, just so you know, this is why this is an important one for me to have, and can really do some of that filling in for the officers. We also think that it's improving the officers' engagement and desire to help on these calls, because they're seeing positive outcomes happen. They see resolution, and even if there's not resolution, they have a support or an expert out there with them to help resolve it versus them trying to figure it out on their own. Some of our learning opportunities, again, not all encompassing. There's plenty more where this came from, but we started to have routine meetings. We didn't have those before because we were growing so quickly that we were just trying to keep up with it. But we now have, if you're a new employee with me, you have weekly supervision for 6 months, and then you go to every other week. Of course, they always call, or we have instant messaging where we can all see if we're on our computers and available to send a quick question. We have a team meeting with all 11 co-responders. So again, we have 8 programs, but we bring them together monthly so that we can all talk and learn together. And we've started having clinical consultation in there, which has been really valuable, because I tell you, we come across some situations that you can't look up in the ethics manual. And so we have to keep each other accountable and support and learn from each other with those conversations. And then program meetings, we have those with each program. It varies on the size. With our biggest program in Overland Park, we meet monthly, and then our smallest ones, it's quarterly usually. Big events, that's a broad term, but if there's a big event that is likely traumatic and if a co-responder is going out to the scene, then I am going to go out and meet them as well, regardless of the time of day, to be a support to them and to help out. That's something that we didn't do originally, and again, secondary trauma has been something we have had to learn from in our programs. We lost an employee. She left us because she was having too much difficulty with the work. And I think the difference is that you have clinicians inside the police department, and you're hearing things that clinicians aren't used to hearing, aren't trained or ready to hear. And you do read gory police reports, frankly. And so we do what's called a professional quality of life. We do that quarterly. With my staff, they give me the scores, and we talk about it in supervision to make sure we're doing okay and checking in and how can we take care of each other. We also have safety as a really important part of making sure we are secondary responders. We unfortunately have been on a scene way too early, and it was not pretty. I won't go into those details, but it was something that we learned to make sure we are staging and we only come in once it has been determined safe by our officers. Now, I will say, I'm going to jump back. With that safety, we also need to know what to do on the scene if we need to, at least to page and use the radio button to get help. And so that is important and something we have had to use. We do have the National Co-Responder Conference. So this is something that Johnson County Mental Health is launching this year. We are very excited. It's only 3 weeks away now. And so I encourage you guys, if you're interested, to come together. This is different than CIT because CIT is fantastic and we need that, but it's a lot more overview and it's more towards getting officers and mental health to collaborate and helping officers know more about mental health. The Co-Responder Conference is different because we are bringing co-responder programs across the country together to learn from each other. You can't go out and Google this very easily to find answers of how to co-respond and lessons learned. And if you get on webinars like this, that will help you. But we are bringing programs across the country together. We have 18 different states coming. We have 32 breakout sessions. It's 2.5 days, and just a lot of great topics from we go into depths of the suicide outreach that I do. I have a colleague in North Carolina. We have a monthly conference call, her and I, and just to talk as supervisors, and she's going to talk about helping how the co-responders help with death notifications. So again, it's going to go into kind of some deeper topics and really look into them. I will say that our registration closes on Friday. So if you're interested, please email me. My email will be at the end, and or go on and register because it's going to be a great experience for all of us, I believe. So data, I'm watching my time because I think we're done at 3 and I want to make sure we have time for questions. So I'm going to breeze through this so that we can jump to questions. But as Dave said, data is critical for growth and success. So here's an overview of one of our cities, Shawnee, where we did the law enforcement survey. So we do a survey right before a co-responder starts and then 1 year post-implementation. And this is just a handful of the questions. We have about 25 questions that we give. And we looked at, so question, actually I'm gonna look at the very last question, how helpful is the mental health system? So I looked at the range of moderately helpful to very helpful. On the pre-survey, we had 11%, and the post-survey, we had 37% gave those answers. That is an increase of 163%. And so that's something that is an officer saying that they now find it that much more helpful. And again, those are numbers that we want to know, and it helps the chiefs and your advisory councils and your commissioners. They need to see that stuff as well as the other numbers. This is a screen. We started out with a spreadsheet like many of you might be doing as well. And then we were able to get a group internally to create an application for us. I will tell you there's a lot of programs out there that people have. Open Lattice and Julata are 2 programs that I know of that are CIT and co-responder friendly. We've just kept with what we have. But this is the data we now collect. I will tell you, we just trimmed this down significantly last October. It used to be a lot more information, but because we're at the place where we're at, where we are sustainable and we have buy-in from our stakeholders, I made the decision to cut back on a lot of that because it was a lot of work for co-responders. And I had to think, do I want my co-responders adding in data, or do I want them doing clinical work? And we had to make the decision for us. And so we found what we think is the most important, and that is the level of crisis intervention, if substance abuse was involved, if there was a suicide number involved, or what that means was. Those statuses up top are important because they're potential for funding streams as well with veterans, homeless, juvenile, intellectual disabilities. Those are all important because there are other grants out there that might support those as well. And then SRO requested, that's that middle one, that's to help us with the growth of our school co-responder program. So if I knew 10 years ago, well, if I was in charge 10 years ago, but also knew that we were going to have school positions, I would have started collecting that then, but we didn't. And so a lot of this we've had to add as we've learned and have grown. But those avoided, those are the bread and butter. ER avoided, jail avoided. MedAct is one we just added, which also to me feels like a duh. We should have done that a long time ago. And we've had a lot of them. And that's a cost savings to our county because we run our MedAct or our EMS services. And so that's something I would encourage you guys to pay attention to. But then I also have on there unsure or none. It's important for me to have 100% of the data filled out so I don't question if it was an avoided or not. So the none is important. But then I also want my staff to be able to put unsure so that we can go back together and look at it in supervision to decide if we think it was. I don't want them to just haphazardly pick something, because that's going to mess with our data validation. Here's just a quick overview. These are our 2018 stats. I apologize, I didn't get 2019 to you all just yet, but so we have contacts. We focus on how many 911 responses. I think this year we were closer to 1,100 911 responses, and that's because we more than doubled our program, so that makes sense. Our rate for ER diversions is close to 38%, and then the jail diverts is closer to 13%. So again, a lower number, but we anticipated that. So I didn't mention this on the data screen, but we also, because we have 6 emergency rooms, we collect what emergency room did we keep that person from when we divert. And this is based on proximity or client preference. So our highest one is up there in yellow. It's actually now Advent. I apologize, I didn't update that, but we diverted from them 51% of our diversions. And so that is something that we can go to them and tell them about, and then they can see how much of a cost savings that is and if they would want to contribute to our programs. So that is a lot of information very quickly in a nutshell that I wanted to share with you all.
Thank you so much, Jessica. I mean, this is some really great information. Even though Johnson County, Kansas is not officially a learning site, I know that I reach out to you constantly asking for help, for TA. So at the end of this, we will share Jessica's contact information. We ask that you go through your TA provider only because we don't want to bombard Jessica with so many different emails. But she is a great ally with us, and she works with us and always willing to help other jurisdictions. I referred your conference to a couple of my grantees who I know will be going. If you are interested in going in the conference, I know it's a couple of, registration is coming up. Speak to your TA provider. Hopefully you guys have some money aside for travel, and that will count. Going to a conference does count. So you guys would be able to use these funds to attend the conference. I think it's going to be great for your jurisdiction. You really learn a lot. We do have some questions. The most important part is that, yes, this presentation will be available. We'll be able to share it with you. If you have any questions from David or Jessica, we'll be able to connect you and to make sure that we have all your questions answered. So we'll start off with some questions that we were able to gather. The first question is, any specific challenges to getting all 11 different law enforcement agencies to the table, and what was helpful in engaging those agencies?
And how many? What number did you say? How many agencies? 11.
Was it 11?
So I've never had one program with 11. Thank goodness. But it is, it is difficult. But we are really fortunate in Johnson County that we have a lot of collaboration between our law enforcement agencies because there's a lot of overlap. So really, they all work really well together. But there can be some differing opinions and some policies that are different. And so it's one of those things that I find it important to try to balance keeping things consistent amongst programs and amongst one program, but also trying to individualize it to meet their needs. And that's a weird balance that you have to find, but it's important to highlight that to them. And I've also tried to make my voice be more involved with those programs so that there's one person who's kind of leading it and they're really contributing to it, if that makes sense.
Yeah. So what strategy have you found most useful in gaining funding support from the community? And what data points have you found most useful?
Yeah, so the substance abuse is definitely one of the most valuable because that's, again, money that's already coming to our cities from alcohol tax. And so our biggest city has a couple $1 million in alcohol tax that they've been able to pull from for different projects, which is fantastic and what we need to see happening. So that's one area. And then the diverts is the other thing I would definitely start off with is so you can tell a hospital that you diverted from them. You also need to make sure it's quality because I've had a historical program that I no longer am involved with where they were marking divert, pretty consistently, and we would have to go back and review them and say, no, this is not a divert. So you want to make sure you have clean data as well. So I think having a quality review process in there is going to be really important where the supervisor or peers will go back and look at the calls together to make sure that they would do it consistently. And then the last thing I would say is, again, paying attention to those statuses because of like the veterans and the homeless populations and IDD, because you never know when you'll need that data. And so having it on the front end from the beginning is really helpful so that you're not doing it like we have, 7 years into the program.
Thanks. Does your team continue to participate in strategic planning efforts to expand or enhance?
Did we continue to participate in what now?
Strategic planning in efforts to expand or enhance.
Yes, so we did, so the sequential intercept mapping has been critical for us. So we did it again 2 years ago, and that was really helpful again. And then Johnson County, just in general as a county, is focused on strategic planning. And so we are as well at the Mental Health Center being a part of the county. So it is a part of our everyday conversation. So yes, it is a part of our work.
How can we make the best use of our research partnerships during the strategic planning phase?
Ask any and all questions you can. No question is a dumb question. I think people sometimes are worried that they should know something, and but just be willing to learn and make mistakes, because I think that that's something that is going to happen with these programs. And that has, again, that's why I have that lessons learned opportunity on my slides. And again, I have so many more I could share, but I didn't have that coming into the position. And so I think that when you're talking with other programs or with your advisors, ask what lessons you need to be aware of and how other people, so that you can avoid what other people have gone through.
Great. Last question, are clinicians able to bill insurance for any services they provide?
Great question. Another question I get that's similar to that is, do we have do they have to sign an authorization to treat? In Kansas, we have statutes that say for crisis intervention, we can bill that without having you sign it. Now, for co-responders, we do not bill anything. We could, if we chose to. We're keeping it clean on our side right now because of the fact that we cannot profit from these positions since we're getting the positions paid for from the city. So we don't want to then turn a profit from billing. Now, if we decided to start billing, which we've considered, because we could bill crisis intervention, for those who have Medicaid and whatnot, then we would have to take that from what we're billing to the police departments, and we haven't gone down that road at this point. But I know a lot of programs across the country do. And I also know a lot of programs across the country will have people sign authorizations to treat. Again, we have not done that. We've had 9 years where it has not been an issue. And generally, people are happy to have our support. Although another lesson learned is there are times where people, due to maybe their symptomology or presentation, that they are not pleased with our efforts. And so that can be a tricky dance that we have to work on with the citizen and the officers.
Great. Well, I guess everybody, if any other questions before we move on? I know we have 2 minutes. So, yeah, just one just came in. Do you have a standard definition for a mental health, behavioral health involved 911 call?
That is a fantastic question. So that is something that, because we have so many cities that we're working with, they all have their own mental health call for service. My goal would be that we all have the same one. But again, that's one of those questions that you asked of 11 chiefs working on the same project. Getting them to all have one policy is a little daunting, frankly. But so we have a similar one, and I can share that. But it's one of those, we have it in policy, but not to sound not political or not, supportive of policies, but oftentimes you have the policy, but then the officers aren't reflecting back to that to make sure they're meeting those needs. So what we generally say to officers is anything above the neck. If it involves anything above the neck, meaning the brain, send it our way and we will figure it out. Because we don't want to have them have to be pseudo clinicians to figure out, is this schizophrenia, is this drugs, is it dementia? We can do that, so just send it our way. But I'm happy to share what we have, as well as all of our data definitions that we have, if whatever would be helpful to folks in their journeys.
Great. Thank you, Jessica. So we're moving on. If you have any other questions, please reach out to your TA provider, and we will make sure we get you connected with Jessica. Here's the contact information for David and Jessica. We'll leave it up for just maybe a next minute. You could get that information. If you want to be connected, please reach out to your TA provider, and we will make sure we get that connection. Once again, this presentation will be available, so we will be able to send that out. Okay. Once again, we thank everyone for participating. We really appreciate it. If you have any questions or concerns or anything, want to make connections, please reach out to your TA provider, and we will make sure that we get you connected. A big thank you to David and Jessica. This was a really great presentation. I know I was taking notes. I'm sure the grantees were too. We thank you for being a resource to us and for the grantees. Thank you so much. We hope everybody has a great rest of their evening. Bye, everyone. Thank you.